as I said at the beginning, there's a word for doing things in medicine when you don't know what their effects are, and doing them anyway, and that's negligence. And I think the approach to this healthcare crisis has been negligent, both politically and scientifically and medically. And we really need to look into it. We really need to do better next time.
Welcome to the Fat Emperor podcast. I'm your host, Ivor Cummins. Another fascinating discussion today, and we've got someone who I was incredibly impressed with over the months of April and May 2020, because this gentleman was doing incredibly insightful articles in the Spectator Magazine around our current viral issue. So it's Dr. John Lee, who's the retired Professor of Pathology at Hull York Hospital. And John, it's a delight to meet you now after reading so many of your informative articles.
Thank you.
And just in terms of your background, obviously pathology is something where you really get to know the workings of the human body. And a couple of my most insightful people in the network over the past years have been pathologists like Dr. Joseph Kraft, who did around 15,000 insulin glucose assays back in the 70s and discovered the enormous connection between diabetes and heart attacks. And then recently, Professor Sobotin, a Russian in America, who has basically decoded cholesterol and heart disease. So pathologists seem to have this wisdom and knowledge beyond the average specialty, at least I think. What do you reckon?
Well, I'm glad to take that. Yeah, I'll take that. My background is slightly unusual. I did a BSc in physiology at University College London. So that's how the body works. Followed by a medical degree, followed by training in pathology and cellular pathology in particular. So I guess I'm sort of a person who's an expert in disease, but I also know quite a lot about how the body works and how you deal with it. So it always seemed to be they were the interesting things some of the interesting things about medicine anyway.
Yeah, for sure. And excellent discipline anyway, as I said, and just perfect experience to be talking about this topic, the current viral issue. And we're going to get into that, and we talk briefly about what we might cover. But I just want to share something up front for the viewers, in case anyone's a little sleepy, to just wake them up on this issue. So I'm going to go to share now. So here, I just thought I'd run by you and see what you think, John, up front. So some notable professors of immunology, mainly in Ireland, have been on the mainstream media every other night. And they're directly guiding the public on how big an issue that this current coronavirus is. So briefly, Ireland with lockdown, Sweden with no lockdown. We've got Ireland at 0.036% fatality rate in the population. And these professors have been very clear that Sweden are kind of a disgrace, very strong language used. They didn't do a lockdown. It's kind of an absolute mess over there and a disaster. Yet the thing the viewer might not realise is that Sweden are 0.051%, which is practically the same if you take into account their care home ratios, Somali ethnics, etc. And then Europe is 0.039%. So that was one thing, that the rhetoric against Sweden bears no relationship to the actual data. But the other thing that was fascinating was they talked about what would have happened if Ireland had not done a lockdown. And basically I have apocalypse there, because they said that Ireland would have had 28,000 deaths extra. And I think this might have come from the Imperial College models, which means Ireland would have looked like this. So what they were actually saying to the public, but the public wouldn't realise the data, is that Ireland without that lockdown we did in March would have had around 15 times the death rate of non-lockdown Sweden. So anyway, I just wanted to share that to kind of zone people into some of the messages that are going out there from the very top experts on the main national channels. How does that strike you, this assertion?
Well, I think that's exactly what it is. It's an assertion. One of the things that's been worrying me throughout this whole episode is that we've been, we were precipitated at the beginning into a certain narrative to do with this virus, which was very, very serious, and we had to take these drastic actions. But the narrative is not based on empirical data. It's based on modelling. And modelling is not something that can be done on its own in isolation. Modelling has to be it has to be tied to real world data. And the only models that are really any use of science are models that have predictive values, that you predict what's going to happen in the future, and then you compare that with what actually does happen. Models that look back at what happened in the past are not particularly useful, because there are literally millions and millions and millions of ways, probably an infinite number of ways, that you can model a past curve mathematically. So the problem with that is you don't know which one of those is true, and you don't know which variables are the right variables to be looking at. So when you say that this is an assertion that lockdown has worked, that social distancing worked, that the deaths would have been this without it and they have been this with it, that's exactly what it is. It's simply an assertion. And that assertion is based on a narrative that was started at the beginning. And that narrative, in my view, is pretty much fallacious. And so we've really been doing a lot of damaging and harmful things that we didn't need to do. And I think that's a great pity. And I think it's important that people know about this sort of thing so we don't get into this in the future again.
Yeah, I'd agree. That's the kernel of it. And if we go back to March, I guess in general, in March, I was saying, okay, I'd seen the data from the Diamond Princess, I'd seen the Chinese data, I'd seen the shape of the curves, and I'd seen the comorbidity and age patterns. And I thought, well, okay, this is going to be a tough flu, but you know what? It's not going to be the end of the world. And then in March, when the lockdowns came on and everything went a bit crazy, I thought, whoa, I'm not sure that's going to make much change. Hygiene and distancing would have been enough. But you know what? It's understandable because there's a panic. And the precautionary principle, why not lock down for a few weeks and make sure the hospitals are not overwhelmed and we don't have people denied care? You know, I could understand it. So maybe back then, do you think it was understandable, the actions that were taken? Because I know now I changed my opinion a lot in April and we'll talk about that. But back then, was it sort of reasonable?
I think you can understand why it happened, for sure. I mean, the frightening pictures, the what turned out to be misinformation about the lethality of the virus, what turned out to be essentially misinformation about what the virus is, what it does, how it behaves, all the rest of it. So I think you can understand the panic. But I would say two things about that. First is that there's a basic principle in medicine that when you do something, and this dates back to Hippocrates, the principle, first do no harm. So before you leap in and do an operation or give somebody a drug or do any medical procedure, you need to be sure that what you're going to do isn't going to be worse than the thing you're trying to cure. And of course, the question is how we do that. And normally we do that by doing clinical trials and peer review and figuring out how things work. But at the very least, if you're going to introduce something as severe as lockdown and taking away people's freedoms and shutting down the economy, you'd have thought that there would be at least a preliminary assessment of what the consequences of that were going to be. And there was none of that. There was nothing. So in normal medical times, in normal medical practice, if you do something to people that you haven't assessed the possible downsides of, there's a word for that, and that word is negligence. And I think that what governments were guilty of was negligent management, because they did something incredibly drastic without really knowing what they were dealing with. So although one can understand the panic aspect of it, I still think it was actually the wrong thing to do. And I think time has proven that it was definitely the wrong thing to do. And the second point is what you mentioned about the precautionary principle. This is a principle that drives a lot of policy making in modern democratic societies. And it's presented as a good thing. It's presented as better safe than sorry. But the trouble with that is better safe than sorry is only true if you know what you mean by better, and you know what you mean by safe, and you know what you mean by sorry. And if you don't know what you mean by any of those three terms, it's not true. And it may well be not true. And I think actually people deserve to know more about the precautionary principle, something I want to write about, to know more about the precautionary principle, because I think it's a dangerous principle. It's actually anti-scientific, because the specific wording of the precautionary principle says that you should implement things to ameliorate harm, even when the scientific chain of causality isn't fully there with that harm, and even when you don't know what you're going to do is going to do, which seems completely topsy-turvy to me, because if it's worse than the actual harm you're trying to prevent, clearly it's worse. So I think on both those counts, we've got a lot of learning to do in terms of public policy.
Yeah, and I'd agree. But again, I understood the approach, but didn't agree with it technically, but understood it because I know how politics works, etc. I was surprised, though, that more experts who are advising the government weren't better informed. And just on that point, I think you're familiar with Professor Michael Levitt of Stanford, who won the Nobel Prize for modeling chemistry in 2013. I interviewed him. But he, back in February, had modeled all of the Chinese data, which you could argue was not fully dependable. But he saw that the R value shifted and changed and the curve came down independent of lockdown. And then he made a quip that you could say China's not dependable or they're lying or something, but he said they would have needed a time machine because when they did the Italian data, it was the exact same. So the curves were going to go their own way, kind of independent of most measures. Now, he wrote to Neil Ferguson, got a reply, and they basically just told him to go away. And he explained it mathematically. He said, guys, you're out by a factor of 10 to 12. And that's been proven in the past few months. His prediction has never been wrong, any country, and the population fatality rate is around 0.0405. So why do you think the experts wouldn't just even discuss or entertain the idea they were wrong? They seem to be mindset on this model and driving it forward remorselessly.
Yeah, I think the thing is, if you're a Nobel Prize winner, I guess you can say lots of things that other people wouldn't feel confident enough to say. And I mean, sadly, I'm not a Nobel Prize winner, but I'm retired, so I guess I'm not constrained by the sorts of things that people are constrained by. I think there is a very constraining type of atmosphere and management atmosphere within healthcare and within health services, certainly in the UK and probably in other countries, which greatly inhibits people from sticking their head above the parapet unless they're sort of, pretty brave, I suppose, or foolhardy, however you see it. And the other thing is, of course, the almost the entire public commentary on what's been happening has been from, if you like, official scientists, people who've been on the government committees. There's been essentially a blanket censorship of any other alternative viewpoints. And of course, people who are on committees, while they may have a diversity of opinion, in my experience anyway, they tend to be the sort of people who like being on committees, and you don't get to stay on important official committees if you rock the boat. You tend to exit from those committees. So unfortunately, those committees tend to do two things. They tend to make recommendations which are extremely cautious, and they tend to make recommendations which follow the official narrative. And I think both of those things don't help you get a full picture. I mean, I think one of the things that people in general don't necessarily understand is that science, it doesn't work on consensus. Science works on healthy debate and healthy division of opinion. And particularly when you have a new pathogen or a new disease or something that isn't well understood or that isn't supported by very good data, all of which things were true for coronavirus still, but particularly at the beginning, that debate is more important than ever. It's essential that you have proper discussion and divergence of opinion so you can try and hone in on what's really true about these things. What we actually had was very quickly at the beginning of this crisis, governments took a particular view and a particular line, which many of us thought and still think was catastrophist and alarmist and not supported. But having taken that line, they're like a super tanker. They're still going full steam ahead on the same course. They haven't been able to apologise. They haven't been able to admit fault. Not blame. I mean, I'm not in the blame game. I don't care about who said what when, but I do care that we actually get to the truth and we get to the right thing. Anyway, governments and politicians seem to be pretty unable to do that, and their scientific committees get dragged along in that. And I'm afraid I have a poor view of scientists who will stand up pretending not to be political when their entire jobs are political, at least their entire committee jobs are political, and they just simply will not diverge from what has become the official political line. Now, that isn't science to me, and it isn't in the public interest either, unfortunately, but that's what we've been being subjected to as far as I can see.
Yeah, John, well, to be honest, I don't know, I'm 51 years of age, but I have never lived in my lifetime through such a period of unscientific thinking and anti-science, I'm actually calling it. Because from mid-April, the data was quite clear. Whatever about Professor Levitt predicting in advance, it was clear by around mid-April, and I expected that the lockdowns would be rapidly taken away as the curve shifted downwards, following its normal seasonal pattern for viruses. And when that didn't happen, I realized science was kind of flushed down the toilet. And it continued to happen. And recently in Ireland, there are many university professors getting on television saying that in Ireland now, with nearly no deaths at the end of the cycle, we need to lock down hard now to crush the curve. And I'm thinking, okay, science isn't just down the toilet now, it's out into the bay with the sewage. How could they possibly say that? How does that strike you in terms of scientific thinking?
Well, poor, obviously. I mean, I think the trouble with it is people have gone down, some people at least, have gone down a particular route. And I think one of the things that's come over to me in this epidemic is that certain infectious disease experts and epidemiological experts are guilty of doing what academics often do, which is a total, utter focus on their own particular tiny niche and a total belief in its validity, a complete inability to see the big picture and a complete inability to see other possible explanations. And fundamentally, I think that's what you're getting. I mean, I've always said that, academics, having been an academic myself for 30 years, I possibly having been more interested in the big picture side of things than most people are, I've always said academics often have very, very erudite and highfalutin and complicated ways of getting things completely wrong. And I think that's what we're witnessing. I certainly don't think those opinions, which are the ones that are constantly broadcast, are the only opinions of educated and informed people. I don't even necessarily think they're even a consensus opinion outside the government bubble, but they serve the purpose at the moment. I do think they're guilty of only looking at selected data. I think they're guilty at looking at an awful lot of data that's not even being peer reviewed. So there's an awful lot of modelling data. A lot of what's being presented, in fact, a lot of what's being presented as science is actually modelling. And like I say, modelling isn't science. Modelling is only science if it's correlated to the actual data. And what the evidence of our eyes tells us is that this infection is going away. The curves in different countries with very different ways of dealing with it are very similar. Second waves of infection, such as they're coming on, aren't correlating with second waves of death. And basically, the only way in which you can continue to believe in the modelling that's been done is if you believe that the lockdown has been 100% effective and social distancing has been adhered to the letter and it's absolutely stopped this virus spreading. Now, I find both of those things completely non-credible. You've got to appreciate how tiny a virus is. When you've got an active viral infection, you could be breathing out 10 million viral particles per breath. And okay, some of those are in big droplets, some of them are little droplets, but the fact is big droplets will fall to the floor, they'll dry out, they'll turn into a flake. As somebody else walks past, they'll turn into a dust mote, they'll go through the atmosphere, you'll breathe them in. The idea that walking 2 meters behind somebody in a supermarket, you're not breathing the same air as they are, and you're not breathing the same particles is total bunkum. I mean, who can possibly believe that unless you just want to suspend all critical faculties? So it seems to me that this is an airborne virus. And the evidence from the past is that we don't have measures that stop the spread of airborne viruses. They do what they do. So what would have been a sensible approach, I think, to this epidemic? Okay, if we locked down for 3 or 4 weeks, but after that time, we could see that if you're under 60, you've got virtually less chance of dying of this thing than if of drowning or being struck by lightning or, lots of pretty rare things. So the sensible approach would have been the approach that we first took, which is to recommend to people who are vulnerable to self-isolate and to let everybody else carry on. I mean, virtually the entire economically active populations of all our countries are virtually not susceptible to this virus unless they've got something otherwise seriously wrong with them. So to keep everybody off the street for this period is just totally ridiculous and not based in anything sensible that I can see. And to call that a precautionary principle, I think is a misrepresentation of the term, really, because actually you're doing far more harm than you are doing good by doing that with absolutely no evidence to suggest it's a good idea. So I don't think social distancing, the lockdown, I don't think there's any credible evidence that they've really done very much at all. And the other point, the other point we're saying is that in terms of the deaths, obviously different countries have been counting these deaths in different ways. Some countries have been very rigorous about only counting deaths absolutely attributable to the virus. Other countries like the UK have been pretty much counting any death where the virus was in the room. And obviously they've got much larger numbers. But the point is, if you look in the UK, and I've seen the raw data for this, so if you take the numbers off the website for National Statistics, the Office of National Statistics, and you look at the all-cause mortality deaths for the last 27 years, and you correct it on a yearly basis for population, this year is not first, it's not second, it's not third, it's eighth. And so it's not a particularly exceptional year. And then the other thing is, if you look at the deaths of the last 5 or 6 years, 3 or 4 of those years have had significantly below average mortality because there's been not a very bad flu season in those years. So the fact is, this year we happen to have an inflated population of old and infirm people who were going to be carried away because, and I'm not being horrible about saying this, I mean, you're talking about death in this way isn't being horrible, it's not being uncaring, it's not being insensitive. This is just a fact of life. We get old and we become more susceptible to certain diseases and we die. And infectious diseases are an important way still, particularly viral infectious diseases, of carrying away older people. So this year we already had an inflated population of older people who were going to be carried away by the next serious infectious disease season, whether it was flu or, as it turned out, to be COVID. So what I think we've been going through with COVID is actually not a viral crisis, it's a crisis of awareness, because people have been obsessively looking at this virus after the hoo-ha created by the World Health Organization, which is another organization which I think needs serious looking at. They caused a crisis of panic. People have obsessed over this virus. In my opinion, this virus is hardly, well, it's not actually outside the envelope of other infectious diseases like flu that we live with. What we've been suffering from is more a crisis of awareness, really, rather than a serious viral crisis.
Yeah, I'd agree. Well, there's a lot to unpack there, John. But yeah, I'd agree. It's hyper-awareness, hyper-reality. It's insane and it's unscientific. And it's kind of a mob rule, kind of everyone's gone crazy. The governments are feeding off the craziness, feeding more back. The WHO, I'm careful what I say there, because to your point about censorship earlier, anything that goes against the WHO, the CEO of YouTube said we'd take it down. So in other words, almost arbitrarily, one organization that has a lot of funding from a lot of different sources was decided to be the de facto correct organization, and we will censor anyone who goes against that, which is very dangerous. But just sticking with the numbers for a moment, so yeah, the Euro-Momo I've been doing and Professor Levitt and others have been looking at, and 2018 is a good compare. There was no crisis, no measurement, no nothing. But 2018 across the Euro-Momo countries, 360 million people, it was around 140,000 excess deaths in the flu season. You know, this happens ordinarily. And then 2019 was very soft, to your point, and the early part of 2020 was very soft. There was nearly no excess deaths. So you had this build-up of susceptible. And then Corona is around 168,000. So it's a little higher than 18, but it happened in a compressed time frame, which generated the appearance of terrible woe. But the reality is, the excess death numbers give you the answer. And the key thing is that people then will say, oh, but we had lockdowns. But then you have to go back to the science. And the science says that lockdowns did very little, if anything. And we know Woods Hole Institute, Levitt, we know the Israeli professor did the analysis. We have Carol Hennigan of the Centre of Evidence-Based Medicine in Oxford and his whole team called this. They said the lockdown was unnecessary because it came after the curve changed and never impacted the curve. And we see that in all the countries, pretty much. The lockdown doesn't impact the curve. So it's very frustrating. But I guess, yeah, the fact that they became wedded to a concept caused enormous impact to the economy and promised the people it would save them. It's nearly impossible now to say, guys, okay, the lockdown probably didn't do much. That's good news, actually, in retrospect. And then get back to normal. So society gets back to normal and we realized, okay, we went off, with a hair trigger. We were worried. But now we got to make sure we never do this again. That this never happens again with something on the order of impact of influenza, that we never do this again. Do you think we're going to get there where there's some realization that we must never do this again unless we get a real plague?
Well, I hope so. I mean, I think one will hope that when the vestiges of the last vestiges of the hysteria die down, that we'll have some sort of cool, calm look at what happened. But of course, because of the way it's been done, getting the data on this is actually now very difficult. Getting true data on death rates and infection rates and exactly what happened is difficult. I think it's also difficult because the disease is likely to have changed over time. I think there's a possibility that the initial disease was quite virulent and the virulence rapidly declined, which is what often happens in these things, except we don't normally measure the early stages of it, so we don't see that. But I think there's an element of that being happening. But I think actually being able to have a clear, well, I hope it will be statistical. I think if we look at all-cause mortality, that tells you the story. And as you say, the only way we can actually justify this type of thing is by believing that lockdown and social distancing have been completely effective in keeping this virus at bay. And I simply don't think that's tenable, even by looking at what happened with demonstrations recently. No obvious infection spike. If you look at the dissociation now between deaths and infection rates, it's interesting that the language of some of the major broadcasters has changed from reporting deaths to reporting infection rates, because they can't find the deaths now, so they want to carry on talking about infection rates instead. So they change the language to meet the story. But yes, I mean, I think it's been a colossal overreaction. I think one of the things that everybody ought to ponder is that historically, when totalitarian states are doing things to people, they always justify what they're doing to people in terms of it's for their own good. It's always for our own good when we're being shot, or when we're being put in prison, or when we're have our freedom of speech stopped, or whatever happens to us. It's always for our own good. And we just have to question whether in democratic societies we think copying a totalitarian model is actually the right way to do things. I mean, it seems to me it's less to do with doing our own good than it is about keeping control of a narrative. So it's more to do. I mean, it's more to do with control, I think, rather than truly doing something for our own good. And I think it has quite a lot in common, actually, with previous episodes that we can see in history where there have been invisible threats. I mean, invisible threats always get people going, because once you believe there's an invisible threat, it's quite difficult to persuade people that the invisible threat isn't there anymore, because they couldn't see it in the first place. So, for example, the McCarthyite communist scares in America, there were Reds under the beds in America. Everybody went hysterical for quite a few years. It took quite a long time for them to realize that actually the country wasn't being invaded by Russia. Another example would be radiation. Throughout the last decades, radiation scares have been quite prevalent, and people still worry about radiation from mobile phone masts and all this sort of thing. It's an invisible threat, hard to persuade people that it isn't there. So when people convince themselves that the sky is falling, this is the sort of chicken licking theory of government, really, isn't it? That when the sky is falling, how do you persuade them that it isn't? It takes a while, unfortunately, doesn't it? But I think that's where we are with the lockdown and the social distancing.
Yeah, and it's basically switched now more to propaganda. It's propagandized because the science clearly has been pushed aside with selective, perception of the data. So it's become...
I was going to say, sorry, I think it's been propagandized since the beginning, really, because if you think about it, what's the difference between investigative journalism and propaganda? Investigative journalism challenges a story and tries to find out somewhere in amongst all the stuff where the truth is. Whereas propaganda, what propaganda does is illustrate a story that we already know. And seeing as the narrative was fixed for us at the beginning of this thing, pretty much all the broadcast media that you've seen and all the talking heads have been illustrating a story that we already know rather than challenging the story. And I think that is the story, really.
Yeah, actually, that's good. The definition of propaganda. And obviously, it's gone up many, many notches, because originally you could almost justify it as an exciting new story and a dangerous one, and everyone's worked up. But now that the media are clearly avoiding the science like the plague and pushing this story, even though the data has come in, it's insane. And just on some of the points of data about the lockdown that we mentioned there, so we've got compares. If you look at the US states, a recent report came out with the 8 least lockdown and not lockdown, and they have a substantially lower death rate than the most. And then if you look between other states, like Seattle with an incredible early lockdown that was lauded in the, I think, New Yorker magazine, and then they vilified New York with its disgraceful lack of lockdown. Well, Seattle ended up with 0.07% fatality and New York 0.19. And if you account for New York's density, northern heavy city, low vitamin D, ethnic minorities, that difference is fully explainable. So even between Seattle and New York, their flagship compare of amazing lockdown versus disaster, even there it says lockdown doesn't work. And New York loaded the old folks' homes with sick people. So every compare, I won't go through them now, but Brazil and Peru, lockdown, no lockdown, same death rate, seasonally appropriately where it is, very different than America and Europe, Northern Hemisphere. I mean, all of the data is screaming at us, but yeah, it's propaganda when you ignore it all, I guess.
Well, yeah, I think it's just the narrative was fixed very early on in this epidemic, and it was based, if you remember, on these very frightening pictures that came out of China followed by very frightening pictures coming out of Italy and then New York and Spain. But the point is, what people don't seem to understand is that selected television pictures are not science. They're selected television pictures. And at the same time that we had those pictures coming from Lombardy in Italy, ITUs 50 miles away in Veneto were half empty because we didn't see any pictures of those. In the UK, when we constantly see, or were seeing, pictures of tearful, staff in hospitals, obviously weren't coping for one reason or another. We didn't see any pictures of the people who were saying, well, this is business as usual, really, or we're actually not that busy, or anything like that. They don't get broadcast. And unfortunately, the other thing about the science is that in the media and in our politics, certainly in the UK, I'm not sure about elsewhere, but certainly in the UK, there are virtually no people with more than the science O level. I mean, hardly anybody was what I would describe as properly scientifically literate. In other words, able to really take a critical approach to data and have enough background knowledge to understand what those data mean and how you can criticize it and what other interpretations there might be and how a different story actually might be more accurate and how science actually works. Unfortunately, there's a bit of a perfect storm within politics and the media of the blind leading the blind. And of course, you can always find talking heads. There will always be some scientists who are very happy to be in the middle of that and to be the great leaders and to be telling us a particular way. And of course, there's much more public visibility to be had in saying we must do this because there are going to be 500,000 deaths, than to say, hang on a minute, we shouldn't do anything. So that guy in Sweden, Anders Tegnell, who's been their state epidemiologist, has been a very brave man, but he's on the money. I mean, even he's been had to be, for political reasons, quite apologetic on television. But the point is, there's a strong body of informed opinion of people who look at this thing, who know about it, who are saying, we should never have gone down this road. I was actually watching this in February myself, and I didn't do the analysis like Professor Leavitt did, but I was watching it and I was thinking, my goodness, there's a head of steam building here, and if we're not careful, this precautionary principle nonsense is going to hit the jackpot. And then it did, which is actually what stimulated me to write the first article I wrote on the evening of when Boris announced the lockdown, because I just thought this has gone too far and it's crazy. But what's been a little bit dispiriting really is, I've written several articles and, I've tried to present, like you and many others have done, tried to present a rational, sort of cool, calm, collected and not hysterical interpretation of this. And it's very difficult to get rational discussion restarted. I actually, at least in public, the only good thing is I do think that there's quite a large silent majority who are not getting airtime and who are sort of reticent to discuss it with their friends. But when I talk about it with people that I've seen, the majority of people that I talk to about it and meet get what we're talking about. The thing is, it's just not publicized out there. So we're living in a bit of a double think, parallel to use George Orwell term, double think world, where there's one thing being put out on our media and another thing that everybody knows is true, or many people know is true. So there's a lot of issues here to do with freedom of expression, freedom of speech, but most particularly, I think, is, I don't care who's in charge. I don't want to be the big person in charge. I don't want to be, a talking head on television particularly. I was quite enjoying my retirement. I retired 2 or 3 years ago, and I was quite enjoying, going for walks in the country and all that sort of thing. What I do care about, though, is the truth. And I do believe, in a sort of non-postmodern sense, as a scientist, I don't believe it's all about opinion. I believe there's a real truth out there. And what we should be trying to do is circle around it to try and get near the real truth, as opposed to whatever narrative it is we've just picked now. And unfortunately, the media and our politicians, having been mainly humanities trained, they seem to think opinion's everything, and they don't really care what they're broadcasting as long as it all makes sense to them. And I think, unfortunately, that's the world we're in, and we have to do better in future in terms of managing uncertainty and in managing things that we don't know about. There's actually a very good book about that, just been published this year by Mervyn King. He used to be governor of the Bank of England, and another economist called John Kay. And the title of the book is Radical Uncertainty, and it's about how we make decisions in a very uncertain world. And they have a lot of very sensible things to see about how you make decisions and how we can do that sensibly. And frankly, probabilistic modelling, which is what's been driving this whole narrative we've got, isn't really one of them.
Yeah, it creates surreal scenarios and then everyone gets bought into them. And you mentioned Tegnell, that was I couldn't believe he was ballsy to do that, but he was also scientifically correct, though others would argue against it. But at the end of the day, Tegnell, I showed earlier the slides, it's around the same as Ireland they've come out with. And just today, I got an update on a very interesting situation that there's around 2 million people in the lower western part of Sweden. And right nearby, there's the Danish region, and they've got a couple of million too. So they're big numbers, plenty to show mortality rates. But you've got the Denmark lockdown rules there, and in Sweden, you've got the Sweden rules. And they've the exact same mortality rate. So it's a perfect natural experiment. Millions of people near each other. So in that compare, you see that Sweden policy was perfectly fine and was the same as the lockdown. But everyone wants to compare with Norway and Finland, but then they're not counting the same way and they're more sparse and there's huge differences. People are picking, they're cherry picking. If you look at the global situation, countries and states, there is no correlation with lockdown. Like we said, they didn't impact the curve. But people are desperately seeking out cherry-picking compares to justify their belief. That's cognitive bias at a grand scale.
There's another very good book actually by a guy called Jonathan Haidt, Haidt, called The Righteous Mind, which is about human moral decision making. It's very interesting. He's a psychologist, a moral psychologist, and he's got lots of very interesting things to say about it. But the thing that I've found fascinating about that book, which I've read fairly recently, is that it's absolutely a dead ringer for what's happened during this episode. And one of his main theses is that we all like to think that when we're faced with a decision about what to do, that we weigh about what's right and wrong, that we weigh the evidence and we carefully think about it and then we come to a conclusion. But actually what all the psychological evidence shows is that what we do is we jump to a conclusion and then we adduce all sorts of evidence to justify it afterwards, which is why people find it so difficult to have political or religious discussions, because basically they're simply not talking about the same thing. They're all adducing information, cherry picking information to justify their own position. It's an absolute dead ringer for what's been happening. It's the way human minds work, unfortunately, but that way is not a scientific way. Science is an unnatural way of thinking for most people, which is why people can't, untrained people, can't easily do it naturally, because it isn't something that comes naturally to the vast majority of people. I think another thing that's worth saying about all this is that when people talk about the science, is that science is so much less certain even than we think it is, because how do we know what this virus is doing? Well, the way we know what this virus is doing is through testing, testing for the virus. And it's almost as if people think that we can sort of just wave a magic wand and there's a test there which tells us they've got the virus. But you have to appreciate that testing for pathological entities is quite a difficult thing to do, and it's difficult to do very accurately. And tests often take many months or many years to develop to a degree of accuracy that you really want to weight important policies on. Now, all these tests that we've been having recently, they've all been developed in no time flat with no peer review. There's little real independent verification of the sensitivity and the specificity and the accuracy of these tests, about whether antibody tests are the right way to find out whether people have had this infection, about whether some people have very low antibody titers, some people have very high antibody titers, whether this number of cycles for the PCR test are right or that number of cycles right, how much cross-reaction there is for other coronaviruses, which normally cause about 1 in 6 infections in any given winter. We have coronaviruses around, so how much cross-reactivity there is for those, how much natural immunity there is in the population due to cross-reactivity with the other coronaviruses. Basically, the actual science in terms of identifying where this virus is and who it's got is really quite a mess. So the trouble with comparing all these numbers is that the numbers of deaths are insecure because people different countries haven't been using the same criteria to decide whether somebody's actually died because of coronavirus or because they were ill anyway and they were going to die of any infection that they got, or because they just happened to be tested positive for coronavirus even when they didn't really have that syndrome of the disease. We don't know that, and we don't even know whether the testing is missing great swathes of people who've had a mild infection or asymptomatic infection, or whether it's overcounting in people. We just simply don't know. So even the numbers that we are trying to work with are it's difficult to know how much weight to put on them. But as you say, what there isn't anything to show from any of the numbers that we've got is a great spike of disaster happening because we have or haven't done something. And my view is that the whole lockdown and social distancing approach to this, which we copied from totalitarian China as if a totalitarian response to an epidemic is the normal, sensible thing to do, I just simply don't think there's any weighty evidence to suggest it's actually done anything at all. So most of the harms from lockdown are going to be an enormous own goal that have essentially saved that have essentially probably cost more lives than they saved. That's my, more lives through suicide, through cancer patients not being diagnosed, through people staying at home when they had a heart attack, through people not consulting doctors when they otherwise would have done. It's going to be difficult to prove, but I think the direct lethal harms, let alone the non-lethal harms, but the direct lethal harms from lockdown, I think are going to outweigh the actual number of cases directly due to this virus, which is an awful thing. It's a really awful thing. And instead of patting ourselves on the back about how well we've done with this and how well governments have coped with it and how we've all pulled together, we need to be grown up enough to stand back, have a look at this and actually think, no, this was wrong. It was a mess. We shouldn't have done it. And how can we deal with this better in the future? I mean, when you get a real plague, you don't simply have time to have these arguments. There are piles of bodies in the street. There are dogs roaming the street and cattle not being milked and empty houses and looting. And that's what happens in a real plague, as we saw in the Black Death many times in history. Fortunately, we haven't had plagues like that in recent history. And this certainly has not been one of them.
Yeah, which is borne out by the all-cause mortality across Europe. Compares with 18, 2000 was worse. We know the lockdowns didn't do much. The distancing is questionable at best. And basically it's borne out by the data. And on the immunology, yeah, that's a really good point. I interviewed a guy, Creon Levitt, also a while ago about that. And we just went through all the layers of, your innate immune system. You've got mucosal immunity that doesn't give you classic antibodies. You've got T-cell immunity. And one study showed 6 out of 10 people had T-cell signals that they had reacted to coronavirus, and none of them had antibodies. So there's a huge amount of immunology that's just being ignored, ruthlessly ignored, and instead there's simplistic messages coming from professors of immunology, amazingly. So in terms of cognitive bias that we talked about there, it seems like, take an example, Korea way back came out and said, oh, we found coronavirus in previously infected people who are sick. Maybe you can get reinfected with this, like for the first time in history almost. And that went around the world with breathy tones and excitement almost, right? Then around 4 or 5 weeks later, Korea announced in one small article that they made a mistake and they were only fragments of dead virus. And the half-life was 3 months. So cells lysing would give old fragments. And they said, sorry, mea culpa, we were wrong. That was hardly covered. And the belief was still out there that you can get reinfected. And young people can die. But they don't give you the percentages of young people, which is lower than influenza, relatively. So, I don't know, are there other... I guess it's not worth exploring. Are there other driving forces or influences, whether via the WHO, that are not just the kind of stupidity we're talking about? Are there conflicts of interest anywhere in the system with influential people that are helping, just helping, not creating the madness? I think we did that to ourselves, like you described. But is anyone helping this vehicle keep moving, this ship? Anyone? I don't know.
The thing is, I mean, when something like this happens, there's a very large grey area, isn't there, between science and politics. Some people some scientist types, like getting involved, and doctors like getting involved in politics. They like being heads of department and on Royal College committees and other committees. And without going down the route of, conspiracy theories on this, I think what I would say is that if you take any scientific issue and you go to a meeting about any current scientific issue in research, you will find highly intelligent, highly informed people passionately and even aggressively arguing opposite sides of an argument very, very strongly. And that's just the way science works. It's normal. But normally nobody cares because it's in some little tiny scientific meeting really. And if you're not interested in the tiny little thing they're talking about, you don't care. And then eventually, after some time or whatever, a consensus appears after people have had all their arguments, and some people were more right than other people, and you go on to the next thing. So that's all fine, and that's actually how science normally works. But the thing is, when it matters is when the science is directly feeding into politics, as it has been in this thing. When the science directly feeds into taking all our freedoms away, then it does matter. And I think some of my colleagues in science and medicine simply haven't understood that when they say things now, these really have big effects. And you should be jolly sure what you're saying and how you're leading people before you say them. And I think some of the people, having said certain things, probably behind the scenes have been a bit shocked with what they've said, what it's caused, but they can't take it back now because obviously they would be pilloried and So some of them in that position. I think some people sort of like joining a bandwagon, and you always find people like that in any walk of life, at any seniority of life. And they will have their reasons for what they want to do, and they'll probably be able to argue cogent scientific reasons for it if they're that sort of person. It doesn't make the reasons true, does it? So I think the point is you can't really know what the truth of something until enough discussion has been had and enough data has been had. So I think I can understand a really wide diversity of opinion right at the beginning of this thing, because it was frightening looking. We were being regaled by propaganda even then, but it was frightening looking propaganda, and you can understand people taking a range of views on that. Certainly what I've done, I mean, having felt from very early on that this was wrong for all the reasons we've been discussing, I've tried very hard to keep looking at myself and saying, is what I'm saying about this right in this thing, or am I just going off on one? Am I deluding myself? Am I as guilty as anybody else of talking a load of rubbish about it? But frankly, it does seem to me, as we've been discussing, as you've been saying, it does seem to me that however we cut this, the narrative we've been being fed is just completely wrong. And we've invented something for ourselves. We've invented a great big rock for everybody's back. And there just hasn't been a justification for it. So I've tried, and I am trying, to be as open-minded about this as I can, because I think that's what good science does. Unfortunately, my experience in science is that many people doing it don't necessarily do that. They jump on a particular view and they stick to it. And this is why when you look at something called the hierarchy of evidence, at the top of that hierarchy is what we call randomized controlled trials, where you compare a treatment with placebo, in other words, with something that has no treatment effect with the treatment, to see whether the treatment actually really works and what it does. That's sort of the strongest evidence you can have. Right down the bottom of the evidential pile is the opinions of committees and the opinions of authorities. And the reason is because, it's because of this sort of saying, old men don't change their minds, they just go away. And the thing is, unfortunately, a lot of experts, having tied their particular colours to a particular mast, will always find reasons why that's the correct mast and nothing else is true. And committees, of course, because they have a diversity of opinion, because they're naturally always going to be cautious in their recommendations, and because they are tied to a particular political narrative, will often make compromise recommendations that are effectively not scientifically valid. And I think anybody who's ever served on a committee will recognise that scenario and its unsatisfactoriness. And unfortunately, in a situation like this, where what they say has such big effect, I think that's even more true. They're going to be even more cautious than normal. They're going to be even more careful to try and distance themselves from any blame that's coming afterwards. As a society, we're not very good at accepting that people get things wrong for perfectly legitimate reasons. We're not very good at accepting that and allowing them to move on and have another go another day. We're very into the blame game, at least, and certainly on the media, we're very into the blame game, which is actually a destructive and non-constructive way of dealing with things. And again, in this particular scenario, I think we've hit the perfect storm of that. We see the government scientists and the politicians simultaneously hiding behind each other while nobody wants to take any responsibility for anything. And unfortunately, that leaves the only people, and of course people in work, they don't want to put their head above the parapet because they may well be stamped on for saying the wrong thing, and so there are career and family consequences for all that. So it leaves it to a few people like me who are willing to put their head above the parapet, and I would have probably done it anyway, to be honest. I did it once before when I got involved in some public dissection programs that were actually in the event very well received, but at the time nobody would touch with a barge pole, and I did that. So I mean, I will stand personally. I will stand up and speak for these things, but most people won't. So a few people like me, and Nobel Prize winners who feel actually think they can pretty much say what they want, and nobody's going to fire them. But there is an atmosphere of constraint, and I think it makes it for a very imbalanced picture, which is unhelpful in terms of debate and unhelpful in terms of understanding what's really been happening, which presumably we all really want to do, understand the truth.
The truth, exactly. And I didn't pick up on it earlier because there are so many topics you brought out. But yeah, understanding the truth for me, the technical truth, has always been an obsession. So I'm 30 years leading complex problem solving teams. And it's just one of those personal things. Some people hate when people just lie in general. And I know that in a corporate world that I was in, lies are needed sometimes. But one thing I can't tolerate is the technical truth that is twisted for political purposes. It always drove me crazy from the first year of my career. And this here is obviously such a big version of that. I'm going crazy for 2.5 months now. An immunologist, a professor in Bern, Switzerland, a video came out yesterday of an interview that was stunning. And he actually covered everything. And he said at the end, he went through all of what we said about all the layers of the immune system. He said it's absurd what's being said by people that he would expect to know how this works, right? So they're all cognitive bias. But he also said in the last few minutes that his students, past students who are now in careers in immunology, have privately said they really appreciated his thoughts on this and they agree with him. But they said we can't say it because of our careers. And also other senior people in immunology. In Ireland, I've been told by my doctor network, there's one very senior immunologist who, on the basis that her name would, or his or her name would not be used, said the same thing. This is around like a bad flu. It's all elderly and compromised, and this thing is crazy. But again, would not be named. So there's a huge self-censorship as well as the active draconian censorship of YouTube and Facebook. It's kind of bizarre, but I guess it ties in with what you've described, this narrative. The self-censoring is part of it, because when everyone's gone crazy in the group, if you start putting your hand up, they might turn on you. In fact, in this instance, they will turn on you. I think that's pretty clear.
I think, well, I mean, groupthink is a human adaptive response, isn't it, to protect the tribe. And if there's a perceived external threat, we all go and we all sort of bury our differences, go in a circle and point our spears outwards. That's how it sort of works. And of course, it particularly, as I say, it particularly works within an invisible threat because you can't see it, and so it lasts longer because you can't see when it's gone away. And I do think there was an element of that. I think in the first few weeks, the first month or so of this, a lot of people were frightened, and fair enough, because there were a lot of frightening pictures being put about. If you could see it the right way, you were thinking, I don't think this can be right. I don't think this can be the right thing. But I can understand why most people who aren't in the field and don't know about these things would think that. But then the thing is, after that period, people I've been talking to, there are a lot of smart people out there. I think the general public and the general population, we're much more educated than we were 50 years ago as a public, and people, you get a lot of information from television and the internet and all sorts of things, and people are a lot smarter, I think, than professionals and politicians give them credit for. And I've always been heartened by how on the money in terms of just sensible, pragmatic, common sense, everyday thinking, an awful lot of people are. And after that first few weeks, a lot of people that I've spoken to, they can see it. And we set up a little sort of network group of posting things that we thought might be of interest to friends and people, and that's grown to quite a big group. And virtually without exception, people get this, and people haven't been pushing back. So, as I said earlier, I think the silent majority aspect of it is simply not represented in the public debate, which doesn't mean it's not there. And I think it underestimates the sensibleness of an awful lot of our population, young people, and middle-aged people, and old people. People can get this because they are not going to believe something which is constantly contradicting the evidence of their eyes. And as time has gone on, that's what this is doing, despite, in fact, the best efforts of the propaganda.
Yeah, and in spite of censoring, at this stage, probably scores of epidemiologists and virologists and experts who are saying kind of what we're saying for months. The people are not completely stupid. Now, I have been disappointed with some technical people I know, and maybe it's because they're technical professionals and they're very conservative, and they just ally with the message coming from all the experts, and they cognitively can't face the fact that it's as you and I describe. But funny enough, people who are less kind of aloof, there's a lot more common sense coming through. And even one person I know very well said to me way back, end of April, Ivor, in a phone call, this thing is completely overblown, is it? And I said, why, are you watching my podcast? And the person said no, because they don't really watch my stuff. And they said, but I worked out, I don't know anyone who knows anyone, or even maybe who knows anyone who's died or had a serious case. And the other thing he said is, all the stores I go to, all the grocery stores, and I'm bored, so I'm going to a lot of them, I've noticed that those people who are 8 hours a day exposed to everyone, they're non-locked down. There's no infection, no deaths. And I've asked them, and even the older ones, and I've done my little survey, nothing's happening them.
the good example of that is at one stage in the UK, I don't know if you had it in Ireland, but at one stage in the UK, there was a big media little flurry about health workers who died, and people who died in the course of this, apparently of this infection, to the extent that the government even then subsequently announced a lump sum payment of some tens of thousands of pounds to their family of people who died in service. Actually, when you count the number of people who work in the NHS, which is about 1.5 million, and you compare it with the population incidence of COVID, their mortality was below average. So, yeah, if it was true that this was a plague, you would really have an excess mortality amongst health workers who are exposed to the nastiest variants of the virus in the highest concentration in hospital. In fact, they were healthier than the average population. And as you say, I mean, the business about we could do the same study if we wanted to on supermarket cashiers, because all day, every day, they've been sitting there. After a while, they had little sheets of perspex between them and the customers. Do we really think the little sheets of perspex are going to stop viruses swirling around? I mean, honestly, pull the other one. What is it all about? This is actually not this is not science. This is what they call in the military psyops, isn't it? This is psychological operations, where you do things because you try and influence people's thoughts about it with absolutely no interest in whether it's true or not. So the same applies to face masks. Face masks are a complete sticking plaster to make people feel better. They simply don't work. And obviously the perspex in supermarkets don't work. But the point is, if we looked at supermarket cashiers, would we find there have been swathes of deaths among supermarket cashiers? I'm sure we would find nothing of the sort. We'd find they have the same mortality as young people in their relatively young ages, who tend to be most of those people. And that, it seems to me, that absolutely kills the possibility that this could have been a super lethal virus, because where are the people dropping like flies from it? They're simply not there, because it's not that sort of bug. Thank goodness. You'd have thought we'd be celebrating the fact that actually we got this wrong, but actually we seem to be puritanically wanting to wear sackcloth and ashes for as long as possible and get out the cat o' nine tails and whip ourselves raw and carry on going. I mean, I don't know who the people who think that's a good idea are, but we seem to have quite a lot of them at least leading us. But the fact is, these excess mortalities in people who've been exposed to the virus throughout the epidemic are not there. So, there's any amount, as I say, I keep on looking at this, I keep on thinking, could they be right? It doesn't matter how you cut it, it does not add up. So, we should not be doing what we're doing. We should be getting the kids back to school. We should be ending lockdown. We should be getting on with our lives, and we should be helping those who maybe are particularly susceptible for one reason or another to have the help they need to potentially shield themselves if they want to. I mean, this is another key thing. Of the older people who, we've been told that this is mainly to protect, 9 in 10 of those older people don't get this disease seriously. They're not going to die of it. So if you're 80, what would you prefer? Would you prefer to have all the freedoms you normally enjoy taken away from you? You can't go out for a cup of tea, you can't see your friends, you can't see your kids, you can't see the rest of your family. I mean, what sort of quality of life does that give you? 9 out of 10 people who are that age won't suffer from this virus, even if they caught it. So the fact is, what's best? Trying to protect, if you look at the raw numbers, a large number, but if you look at the relative numbers, a relatively small number of people who are probably going to die of this or an infection soon anyway, while taking away everything that makes life worth living for the very group of people you're claiming to protect. I mean, what sort of moral equation is that? It doesn't add up to me on any level, a healthcare level, a moral level, a quality of life level. It just doesn't make any sense. So I on that basis, even, I haven't been able to understand it, because the very people we're claiming to be protecting are being significantly disadvantaged and made depressed and isolated by the measures we're allegedly taking for their own good. There it is again.
Yeah, to be honest, it's a mass psychosis in my mind. And I really resonate with your point. And I've often made the point that engineers and problem solving, the best ones, well, all of them, but certainly the best ones, they must always seek to disprove their own hypothesis. The only way, and you can go back to Professor Karl Popper and all, but you must try and disprove your hypothesis. And in going to kill your own hypothesis, you actually, over time, make a very strong one. So I've been the same. I've been waking up most nights because I'm so engaged with this in the last 2 months. And I literally think, conflicting data that says I'm wrong about this, what am I missing? If I'm missing something, I'm gonna go crazy. So I go back into my office and I go trawl through everything and I try and find the detractors, the people who argue with me. I look at their data again. The person who said the lockdown in this country seemed to actually line up with the R curve. and I re-look at it. Is there any way I'm wrong? And that's driving me crazy. But like you, over a couple of months, I can't find it, you know? And just to address that.
The infection number, the R number, it's the same with the fatality rate. It actually makes no sense to quote a population number for that, because the R number is different whether you're in different age groups. It's different. Young children don't pass it on. Older people catch it. It's different in care homes. It's different in hospitals. It's different in spaced out populations in country areas versus town populations. So there's no such thing as an R number for the population. So what on earth policy is being driven by that for? I don't know. And in the same way, there's no such thing as a fatality rate for the population, because you have particular groups within the population who are very susceptible to this, and you have other groups who are virtually unsusceptible to it. So to quote an average fatality rate and suggest that then we have a one-size-fits-all policy for the population, again, that doesn't stand up on any level. So there are so many bases for not buying this, for thinking that it's wrong, for thinking we've made a massive error for it. And yet it's astonishing, really, that once groups that have got their hands on the levers of power go in a certain direction, and I think it says something actually that's wrong with our democracy and wrong with our ability to debate. It absolutely should be possible for politicians to apologise for things. It should be possible to say, hang on a minute, what we did at the beginning, we did for these reasons, and we were trying to do our best thing. But actually now we look at it, this doesn't seem to be right, and we're now going to do this. It doesn't seem to me there's any shame in that. But I don't think they can even see that, because they are getting fed a particular line from the particular group of scientists in their bubble that they've got. They're not being exposed to the other one, and they're taking the view, these guys are the experts, we're following them. And of course, that's all very well and good if your experts are really on the money. Of course, if your experts are off the money, it's a disaster. And that's in my opinion, that's where we are. And the trouble with it is, these committees, as I tried to explain earlier, and I'm sorry if I'm talking fast and putting too many different things in these, because there are so many things to try and talk about that people, I think, would be interested in. But the point is, these committees, do have a tendency to produce, from even good scientific data, compromise recommendations, which are often quite unsatisfactory to many people on the committee. In this circumstance, where we have poor quality data, which is mainly unpeer reviewed, the quality of the recommendations, which are exceptionally cautious because of the time we live in, are sort of even worse than normal. And I think fundamentally the government's scientific advisors have been advising them unscientifically. That would be my take on it. And they have not been willing to challenge the narrative. And I think it's, it says something about dysfunctionality within the way we deal with these things, which really ought to be addressed in the future. And I think a lot of people ought to look in the mirror and just think about whether what they're doing is or was the right thing. Because I can't see it. I think there's so much that's wrong with this that you're tempted to throw your hands up and walk away, but we keep plugging away, don't they, in the sort of naive hope that this will penetrate a wide enough swathe of the population to gain traction. And I think it probably has penetrated quite a wide swathe of the population, but it hasn't gained traction amongst those who've got the levers of power and who tell us what we're supposed to think on the media.
And yeah, and people wonder why I became so fixated with this over the last couple of months. Usually I talk about, insulin resistance, diabetes, heart disease, and I'm still going to keep at that. But this is so important. I realized in April, because I've got 5 children, and I think a lot about the future for my children. I don't think so much about me. My only concern about my health is if I wasn't there to provide for my children. It still goes back to the children. I live through the next generation going into the future. And I realized with horror in April what was happening and the way this was shaping up to impact travel, working, employment, to rack up debt in the countries. The cancer example is great. 4 times fewer in England cancer diagnosis. So stage 1s or 2s will be 3s and 4s. I know I'm back there to older people, but the collateral damage and the damage to the whole of our societal fabric, to turn from a reasonably robust society that now, on the basis of essentially a bad flu, we're going to turn our whole society into a society of fear, of upside downness. Even the masks. We always looked at the other side of the world with all the masks and thought, well, pollution, yeah, but as you said, the science on flu, very dodgy. But now I look around me, people are all wearing masks. It became law the other day in Ireland, I think England, on public transport. So just think of the absurdity of that. We've had a flu-like illness season. It went through the classic viral curve. It came back down again exactly as predicted by Levitt and many more. And now when it's completely at the bottom, waned until maybe next winter, we bring in a law to put everyone in masks. I mean, this cannot be allowed to continue.
The quarantine that the UK has introduced recently and is now going to unintroduce again for certain countries. I mean, the point is, talk about closing the stable door after the horse has bolted. I mean, basically, some months ago, the stable door fell off and the stable blew up and fell down. And then 3 months later, we sort of try and polish the handle on the door. I mean, it's just ridiculous.
It's off the wall, and I know I'm conscious of your time today. We won't get into it. We might curl around to what should have been done, as in a picture of what would have been scientific and sensible back in March. But one other thing I'd mention though is, and I might send it on to you. Are you familiar with the British Hope Simpson? Hope Simpson. He's a guy who set up the first influenza-like illnesses transmission exploratory laboratory, I think somewhere in the west of England in the 1930s. And he spent 50 years, I know it's crazy, studying the transmission of influenza and pointing out all of the inconsistencies in the hypotheses that they had on it in terms of direct transmission, serial intervals, and a massive amount. And he wrote a book, and I have it now, and I'll send you a PDF. But under what he talks about there, one could question huge more amounts of this thing than even we're questioning. As in, that curve.
Yeah, I completely agree. The truth of the matter is, when you get into the nitty-gritty detail, I mean, we understand certain things about viruses, how they get into cells and how they work in theory and how titers infect cell cultures in laboratories. But when we get into the nitty-gritty of why this week, on this day, you caught a cold, as opposed to not last month or last year, caught a cold, the same cold, when you were doing apparently the same things amongst the same people, the truthful answer is, we don't know. And the point is, sometimes that's the truthful answer, and sometimes that's the best you can do. And the modelling that's being used to drive a lot of this thing makes all sorts of assumptions, and we're told these assumptions are reasonable, but are they? How do we know? The answer is, we don't know. We don't know that the models are accurate. There's nothing that's had much of a predictive value in this. And the fact is, we don't have the data. And if you don't have data, the key thing, I'll come back to what I said at the beginning about the first do no harm thing, because I don't think it can be said enough. The fact is, before you leap in and take actions, you should be sure, with a capital S, that your actions are going to be better than the thing you're trying to prevent. And there are so many examples that one can use in society of people trying to do the right thing and trying to be good about something and taking actions which make things worse. And that's just worse than not doing anything. And the thing is, it takes more courage. I mean, one of the surgeons' best and biggest decisions that they have to make every day is not to operate, it's to not operate. One of the doctor's biggest dilemmas is not whether to give somebody a pill, it's not to give them a pill, and to take the responsibility for withholding treatment that isn't necessary. That's the tough bit. That's what determines, your good medic from your sort of person who hands out pills like Smarties, or people who just takes everybody's appendix out because there might be something wrong with it. The bottom line is, it's the same with politics. Not taking action is often equally or more important as taking action, and that seems to be a lesson that's been forgotten or deeply buried, and we've got to resurrect it, because it's a really important life lesson and way of doing things properly.
It requires bravery and leadership to do that. And I think the statesmen and stateswomen of 30, 40 years ago, post-World War II, they could all do that. And the public was kind of educated and stiff upper lip, and they would expect that from them. But I think our society now, and the way it's gone the last 30 years, and the quality of politicians, you earlier mentioned the way they should be behaving, it's kind of gone down the toilet. So hopefully when this thing settles, and hopefully the data is looked at properly and it's clear as day, and people realize how we messed up, we'll just get some of what we used to have 30, 40 years ago back in things like this, hopefully. So the Ireland, just one thing occurs to me before we go on to what should have been done and kind of wrap with that. Ireland, in the RTE media around a week or two ago, came out with the actual figures, which are hard to get from some websites. And 1,650 deaths, and only 450 of those were hospitalised. And only 80 of those 1,650 deaths saw an ICU. And the average age, or maybe median, The average and median were over 80. And like that data alone says so much that most people were ethically, it wasn't even appropriate to go into an ICU to try and save you, independent of corona. And like knowing that lockdowns, as we discussed, did next to nothing and the curve was baked in, and you can look through the Hope Simpson book to see all that. That means this whole thing was just complete insanity. We didn't save anyone, and the people who are at risk, we couldn't have saved them anyway, really, mostly.
I mean, I think the answer to that is that if you are in a situation where you think your healthcare system may be overwhelmed by a healthcare crisis, what you should do is upgrade the healthcare system rapidly to deal with the crisis. And we showed in the UK that we could do that by building a whole load of hospitals that then stayed empty. The point about the National Health Service, at least in the UK, the health service is there to look after us. We're not there to look after the health service. I mean, I was a lead cancer doctor in my hospital trust for over 12 years. And, all the things that we made a big effort to do, the patient pathways, the getting people in within 2 weeks, the sorting people out quickly, that was apparently thrown out of the window because suddenly cancer patients counted for nothing compared to COVID patients. Heart attack patients counted for nothing compared to COVID patients. Psychiatric patients counted for. So I don't understand the moral equation that says that somebody who's got a disease today is less worthy than somebody who may get a disease tomorrow. So I just think the whole thought process was so scrambled in the early part of this thing that there are any number of things that, as I said at the beginning, there's a word for doing things in medicine when you don't know what their effects are and doing them anyway, and that's negligence. And I think the approach to this healthcare crisis has been negligent, both politically and scientifically and medically. And, we really need to look into it. We really need to do better next time. And there will be a next time. I mean, there's going to be another nasty epidemic. And the fact is, this isn't the way to deal with it.
No, as we said a while ago, this must never happen again. I mean, that is really important. And medically and every other way, as you just mentioned, also mathematically. I mean, this is what kills me. The mathematics and the numbers answer this whole thing, that it was done atrociously badly. But there's the thing, the extra hospitals, that's part of what was reasonable. So if we look now at March, what should have been done, let's say, certainly expanding hospital capacity like Sweden did. They put in 30 or 40%, never used it with no lockdown, never used the capacity, never got near it. They had hospitals set up like military hospitals, they never used them. But it made sense then to not have people denied care, to set up extra hospitals, and they maybe also could have said, well, let's keep extra hospitals in certain hospitals for this problem in case it blows up, and let's make sure we look after everyone else, maybe with separate hospitals or separate wings. That would have been basic engineering management. So let's say that putting in extra capacity made sense, and the only problem you can't beat a virus, so the only thing you're trying to do is slow it so you can take care of everyone. What else should they have done? Obviously not lockdown, but what would have been reasonable in terms of measures back in March?
I think well, often in medicine, less is more. Often in medicine, what you do is you let the body deal with whatever it is, because the body does 99.999% of everything that we do, and medicine just nudges it in the right direction. So, when a surgeon does an operation, we can't heal people, they heal themselves. What we could do is take the pus away, or remove the source of infection, or take a tumor away, or mend a bone, but the bone heals itself. So the vast majority of what we do is helping the body to help itself. So less is more. And I agree with you. I think the main thing that we could and should have done was to make extra capacity in the healthcare system. What we shouldn't have done was to take capacity within the healthcare system away from patients we were already treating until we needed it for new patients. And then we should have had some sensible proportionate decision about who we were treating with those as opposed to who we were not actively treating. So, for example, very old people who were very infirm, who were not going to survive an ITU anyway, shouldn't have been admitted there. So that's just normal medical practice. And then on the less is more principle, had we simply advised, as in fact was originally the case before governments were precipitated into these actions by the frightening pictures, had we advised people who were in vulnerable groups to self-shield and everybody else to carry on as normal, by all means tell people who've got infections to self-isolate and so on, because that will reduce the speed of the spread, if not the total spread over time. What we would have found within a few weeks, we would have found what's actually turned out to be the case, which is that the old people and people with pre-existing conditions were the vulnerable, and we'd have found that children aren't vulnerable at all to it, and we've found that young people aren't really vulnerable at all to it. And so actually it would have quite quickly become apparent that that was the right course of action. And then we could have carried on without all this economic damage and fallout, and as it turned out, without a need to use the intensive care units. And then the narrative would be exactly the narrative that we're talking about, which is, hey, actually, we were worried about this, but it turned out not to be the bad thing that we thought it was going to be. I mean, the irony of this is that the virus that really worried me in recent years was Ebola virus, because Ebola virus was a very nasty plague-like virus that was killing 50% of people infected in Africa. But very fortunately for us, it wasn't very highly transmissible. So that what happened was governments did absolutely nothing about this nasty virus, and cases were in fact spread around the world to various countries. But then when they turned up, they were easy to isolate, and nothing much happened. So the point is, had it not been easy to isolate, Ebola could have been a really nasty disease, as it turned out, on a population basis. As it turns out, it was easy to get under control, and we did. But then with this virus, which is a very transmissible virus born on the air, we've been reacting to it as if it is a containable virus, like Ebola virus, when it isn't. And we've been reacting to it as if it is a very serious virus, like Ebola was, when it isn't. So it's almost like we've got it completely back to front and upside down and the wrong way around. So it's a mess. So I think basically what we should have done is build the extra capacity, make ourselves able to deal with a crisis if indeed it occurred, wait until it occurred before actually switching everything else off, try and reduce the spread as we were doing, not by shutting everybody down, but by keeping the people who are vulnerable isolated, and that would have worked. And then we wouldn't be in this situation. We'd be pretty much back to normal by now because it's gone away, and we can go on to the next thing. And persuading our politicians that was the true way of doing it may take some doing, but that's what I believe.
Yeah, but it's crucial that it is acknowledged and recognised in the coming months. Otherwise, what's to stop you repeating the absurd history again? And especially now that you've got a population who are all reared up and all, I don't know, they've been activated now into panic and fear. So happening again.
Let's not forget the underlying sensibleness of people. I think a lot of people who hear this sort of story can understand what we're trying to say, I think, and what people like me are trying to say, and you're trying to say, and other experts and other people who know about this are trying to say. And I think when people look at it and they think, what have we gained by doing this and what have we lost? I think many people, especially given the fact that it's not clear, they must surely get the message loud and clear that the science on this is not cut and dry. It isn't the lethal infection we thought it was. We haven't saved lives by doing this, we've cost lives. I think once people reflect on that and think about it, I think it'll be a harder case to do this in the future than it was this time.
And, in a sense, the people in that sense, many of them will be inoculated against this absurdity in the future. We'll have a form of psychological herd immunity hopefully reached through looking at what happened this time. Very good. So, listen, there's so much more we could say, but I'm conscious of your time. And we might circle back in a few weeks, actually, and see how things develop and check in on whether sanity returns to the world or whether the insanity kind of period wants to persist for a little longer.
I think much of the world has returned to sanity. What we're hoping is that our politicians and scientists will catch up.
Exactly. Listen, thanks so much, Dr. Lee, John, and it's a pleasure, and we'll talk again soon, hopefully.
Thank you.
Thanks for tuning in, guys. If you're watching on YouTube, you can see my subscribe button in the middle of the screen, and go to extratimemovie.com to see our fascinating new documentary on stopping and reversing heart disease.